afternoon, ladies and gentlemen. As has been mentioned, my name is Greg MacCallum. I'm the Director of New Brunswick Emergency Measures. And last week, I was appointed to lead the New Brunswick Immunization Task Force. Since then, I have been reviewing the preparations made to receive and distribute the COVID vaccine here in New Brunswick. And I can assure you a remarkable amount of planning has already taken place. I'm pleased to report that we are ready to receive these shipments and to distribute vaccines so that New Brunswickers can get immunized against COVID. Now, as was referenced in previous comments, and as we learned yesterday, Health Canada has approved a vaccine for COVID-19, specifically the Pfizer ultra-low temperature vaccine. This announcement follows Health Canada's very stringent approval process to ensure product safety of the vaccine. Also yesterday, New Brunswick conducted a test. It received its first shipment, a dry run, really to validate the delivery and handling process so that we can safely take receipt of the vaccine once it's been safely transported to New Brunswick. These were all successfully completed, and we do have a confirmed method and mechanisms of receiving and thereafter administering the vaccine. Now, we expect the first 1,950 doses of Pfizer's vaccine to arrive in New Brunswick in the coming days, certainly within the next week. Now, you say 1,950. We are a population here in New Brunswick of over 700,000, and that seems a small number. But I want to reassure people that it is the first step of a regular delivery schedule which will immediately follow thereafter. Like other provinces, New Brunswick's basing its prioritization and sequencing on the work of the National Advisory Council on Immunization, their recommendations on key populations to be immunized first. And as Minister Shepherd just mentioned, these include nursing home residents and staff, healthcare workers, older citizens and adults, and of course medical staff in Indigenous communities. However, with small shipments initially and logistic limitations on the first two products, it will take some time to immunize these first groups. The first shipment of product will be delivered to the Miramichi Regional Hospital, which is the site of New Brunswick's ultra-low temperature freezer that has just been installed there. That unit for the Pfizer-BioNTech vaccine is necessary as the vaccine must be stored at minus 80 degrees Celsius. Now, Minister Shepherd already spoke to the priority groupings, and I would like just to reiterate and emphasize that it's important to remember that although the first shipment is a relatively small number, it is the first step for many, first step of many for this immunization campaign. We want people to understand that it'll take much of 2021 to roll out and administer vaccines to all New Brunswickers, but they will be done safely and then efficiently, and the vaccines will be brought to convenient locations for people to be able to access them. Part of the planning is recognizing and realizing that a large portion of the initial steps in this campaign will take place in winter conditions, and contingency plans for the delivery and transportation are certainly being put in place to ensure the most efficient rollout possible. So this is a very important and significant first step, this first arrival, but it's not a finish line. We'll get to the finish line, certainly, but for now, as has been mentioned, we must remain vigilant. We need to follow public health measures to protect everyone's health and safety. And even those who do become immunized early will need to continue to be vigilant and follow those same health measures to ensure that it is a safe process, a safe campaign, and that successfully completed, which it will be, all New Brunswickers can quickly get through this pandemic and be confident that this has been eradicated. Thank you very much.